With respect to other cardiorespiratory adaptations, I mean, VO2 max being, the big one here, right? There's stroke volume increases, cardiac output. How does high intensity interval training affect this? What are those? How does high intensity interval training affect them? Maybe compared to, moderate intensity, continuous exercise.
Yeah, sure. So, what determines VO2 max? And as I alluded to earlier, it's many physiological things, but there'd be general consensus, scientific consensus, that the primary factor that separates individuals in terms of their VO2 max is their cardiac output. So that's what is the maximum amount of blood and in turn oxygen, or the maximum rate of blood and oxygen that's being pumped out of your heart every minute. And so a typical untrained individual would have a resting cardiac output of about 5 liters per minute. So if you were to measure how much blood comes out of your heart in a minute, it's about 5 liters. And maximal cardiac outputs are somewhere around 15 to 20 in an untrained and moderately trained individual. Elite athletes have maximal cardiac outputs of 40 liters per minute. Tremendous. And so again, if you could pick one variable that's going to best predict differences between individuals, it would be maximal cardiac output. And that's determined by how often is your heart beating every minute, what's your maximal heart rate, times what you alluded to, your stroke volume. And so that's just how much blood with each beat is squeezed out of the heart.